This blog is entitled The AntiChain, which is something that I've been thinking about as a slogan or tagline for my office. It's always better to frame things in a positive light. So the way I frame it as a boutique center may be more favorable. But there are a lot of chains popping up in Dallas now where there are multiple locations. They have to hire doctors. It's corporate practice of medicine where sometimes a physician is not even present for the procedure. There's a different atmosphere. There isn't a leadership and a passion and a atmosphere that is conducive toward excellent results. You may just meet with the consultant. You may not ever meet with the physician. You may really just get a very abbreviated consultation. They try to have a high closure rate where they sell you a procedure. They have to have a certain number of patients per day to do the procedure so they can pay for their advertisements. And what we do here is antithetical to that. I call it the anti-chain because we're not a chain. I don't want multiple locations. We're dedicated toward excellent results in a very custom and crafted way for you. I'm intimately involved with the procedure. I'm very focused on your care. I turn away about 80% of my patients who come to me for surgery because I don't think they're a candidate. And that may seem like a very high number, but it actually, if you're working with an ethical surgeon, there's a vast majority of people that would be better managed with medical therapy. And I get my money on being a surgeon. But a lot of other places, they just operate on you because they need to make their numbers. Curiously enough, is some of the more complicated cases, people don't touch. And those are the ones I actually manage because I know that I can do very sophisticated hair surgery. So the boutique idea is that I have one team, the A team. I don't have a random number of techs that come in and out, medical assistants that help me. I have the same team. So we only do one surgery a day. It allows us to be highly focused on your care. We do what's called a timeout to make sure that we're doing the right patient, the right number of grafts, the right distribution. Everything is a very slow process to make sure you get the best care. Some of my other podcasts, I talk more specifically about safety and technique and all those things and artistry. But suffice it to say, in this podcast, I'm really focused on the quality of care in a boutique center versus a chain outfit.